Director for Protect Our Care, and I'm going to tee us off here. And Protect Our Care is a national organization working for lower cost and better health care for all Americans. I am so pleased to join Carolyn Bourdeaux and the esteemed speakers today to highlight the historic opportunity to improve the health and livelihood of every Georgian. It's important to note that this time last year, we gathered with then Representative-elect Bourdeaux, doctors and patients at a press conference about the impact of the Trump lawsuit to dismantle the Affordable Care Act and to speak out against our then Senator Loeffler's proposal to expand junk insurance plans, which both would have put everyone's health care in jeopardy. Now today, we are on the brink of the most significant expansion of U.S. health care since the passage of the Affordable Care Act. And as countless studies have shown, when you expand access to care, you improve health care for all and improve our economy. The health care measures in the Build Back Better Act will lower costs and improve access to life-saving care, from lowering prescription drug costs, reducing insurance premiums, extending coverage, and investing in home care. Of these, there's no more vital provision to Georgia's health and economy than closing the coverage gap, which Representative Bourdeaux recognized when she introduced the Medicaid Saves Lives Act in the House earlier this year. And Georgians, regardless of political affiliation, overwhelmingly support Medicaid expansion. This historic expansion of health coverage will finally ensure that Americans in states like Georgia will be able to access the affordable, quality care they deserve. Because of the decades-long Republicans' war on our health care, millions of people have been left uninsured in Georgia and 11 other states. It's just not right. Thanks to the hard work of Representative Bourdeaux, Senator Warnock, as well as President Biden and the Democratic leadership, the promise of Medicaid expansion in every state is finally a reality. Medicaid is a lifeline. It reduces racial disparities in healthcare, creates healthier communities, and it strengthens economies. By passing Build Back Better, our leaders will show their commitment to building a future where healthcare is a right, not a privilege. And I am so pleased to introduce Representative Carolyn Bourdeaux. Thank you.
Thank you, Liz. I greatly appreciate the work of Protect Our Care in ensuring that everybody has quality. One of my top priorities since I was sworn in is ensuring that all Americans of all backgrounds have access to health care. Georgia is one of 12 states that has not expanded Medicaid despite incentives given to the state over and over again to provide health care through the Affordable Care Act. This means that over 2 million people, hundreds of thousands in Georgia alone, are unable to access the medical care they need due to the Medicaid coverage gap. And this refusal to act has come at the cost of human lives. Medicaid expansion is a social justice issue. Nearly 60% of the people in the Medicaid coverage gap, both in Georgia and across the country, are people of color. This is why I work closely with Georgia Senator Warnock and nearly 40 House Democrats to introduce the Medicaid Saves Lives Act, which would create a federal program to close the coverage gap. I am so pleased to see that one of my top priorities, this legislation, closing the coverage gap, was included in the Build Back Better Act, which passed the House Thursday a week ago. We have an opportunity and a moral mandate to ensure that this is included in the Build Back Better Act, which now needs to go through the Senate and be signed into law. Each and every one of us who has health insurance actually pays for the uncompensated care from the number of people in Georgia who can't get health insurance, can't get health care, and we all pay for that in our own rising health insurance premiums. Additionally, tax dollars from Georgia for a decade have gone to other states all around the country, and their people have had health insurance, but ours have not. Fundamentally, it is morally wrong and it's fiscally irresponsible. The coverage gap fix included in the Build Back Better Act would begin in 2022, so right away, and expand access to affordable health care for over 600,000 people in the state of Georgia. This bill will save rural health care in Georgia, and in our community will provide access to doctors and health care to so many people. I just want to end with a story because I think it helps bring home what this will mean to people. When I started running in the 7th District, I talked to doctors about what they were seeing. And one of the stories that they told me has stuck with me for many years. They told me about a man who had come to an outpatient clinic and he was crippled with rheumatoid arthritis. He was in so much pain he couldn't even hold a pen. And he was a day laborer who lifted boxes in a warehouse for a living. And because of that, he's low income, and because he's low income in Georgia, he doesn't have health insurance because we didn't expand Medicaid. He had waited until the disease had really crippled him before he decided finally to break down and go see a doctor and pay for it. And the doctors had to tell him, "We are so sorry. If you had come to see us a few years earlier, we could have given you anti-inflammatory drugs that would have protected your joints and you'd still be able to work today. But now we are so sorry. The disease has destroyed your joints and there's nothing we can do for you but to give you painkillers to relieve your suffering." The irony is that this man is now eligible for disability, and now he's eligible for Medicaid. But we can all see what's wrong with this picture. It is wrong that we hang our working people out to dry in this way. It is fiscally irresponsible as well. It would have been a lot cheaper to pay for the anti-inflammatory drugs than it is to pay for disability now. So with all of that, I am so pleased that this legislation has gotten included in the Build Back Better Act. It will be transformative for Georgia if we can expand Medicaid in this state. So with that, I will turn it over to Dr. Lichtenfeld, who can talk some about that front lines experience with patients and people who need health insurance.
Thank you, Representative Bourdeaux. And it's a pleasure to be with you and your colleagues and friends this afternoon to support your efforts to help Georgians get access to health care, the access they deserve, the access that they need. I'm Dr. Len Lichtenfeld. I'm a medical oncologist and a specialist in internal medicine, and currently live in Atlanta, having formerly worked for 20 years with the American Cancer Society, where we recognized for many years through research and action it was critically important that people have access to health care to reduce the burden and suffering of cancer in this country. I come to you today to share some personal stories as a physician, some of which I'll mention in a moment are extremely personal. But the reality is we have known, for example, that people with colon cancer who have insurance, who may have later stage disease, do better than people with colon cancer who don't have insurance, even when they're diagnosed earlier. But we also know that in this country, we are failing in our ability to control the most straightforward, most of the time, diseases such as diabetes and hypertension. And we're failing because people do not have access to the routine care that many of us accept. But I'm going to share something that's even more personal today. And I'll tell you that it's my wedding anniversary. Please bear with me. My wife, who happens to be a physician, 9 months ago, almost to the day, developed critically ill COVID illness. She ended up in a world-class hospital receiving world-class medical care. And I'm grateful that we can celebrate this anniversary today because she had access to care. But I'll tell you what would make me even more grateful, and so many of my colleagues were grateful, not just the doctors, but the nurses and the people who have to give the care every day in hospitals across this state and across this country. What would make them even more grateful is to make sure that everyone should have that access, that everyone shouldn't have to fear that because they have a situation such as the representative talked about, such as any condition, that they have to delay care, that they can't afford to get care, that whatever care they get may cause them severe and irreparable financial harm. It is no longer acceptable in this country that we make people make that choice. And particularly here in Georgia, where the passage of this act would help us bring insurance to over 500,000 fellow citizens of our state. It's that critical, it's that important, and it's time we act. We should no longer have to beg that people can get access to care. I have lived in rural Georgia. My wife has practiced in rural Georgia. We have seen what it means not to have access to care. We have seen what it means when you can't get care for pregnancy. We know we lead the country, unfortunately, in so many negative measures of health care. Maternal mortality, the quality of life, very straightforward things that we know where this insurance would make a difference. So congratulations to Representative Bourdeaux for getting the bill into the Build Back Better Act. We look forward to the passage of that act. We appreciate the work of the Georgia delegation who supported it. We appreciate the support of everyone who can make this happen. And hopefully, when this happens, we will be able to say that we have made this state a better state, a healthier state, a state where people don't have to fear for their lives because they have an illness that they can't afford to get health care. So with that, I say thank you very much, and again, thank you, Representative Bourdeaux, for the work that you have done.
Thank you. And I want to recognize we have State Representative Rebecca Mitchell here, who has done just great work. She's an epidemiologist and someone who's been a strong advocate for health care here in Georgia. Do you want to say a few words, or you?
I came into the legislature about a year ago, and I think a large number of us campaigned on the impact expanding Medicaid would have here in Georgia. In the Georgia legislature, currently, that's a hard act. To see the federal delegation working to make sure that more Georgians could have access to and be able to afford to use health care in the middle of a pandemic is one of the greatest contributions that we can see them make right now, and I truly appreciate all of the work going into seeing Build Back Better get through, because it is critical for Georgia right now as we are still directly in the middle of a pandemic.
Questions? Okay, with that, we will take questions.
Congresswoman, I want to delineate. So what happened with Medicaid that was signed by the president, and what does part of your legislation do with Build Back Better, with BBB?
So for almost a decade now, Georgia has failed to expand Medicaid, and this is health insurance for people at 100% of poverty and below. And it affects a ton of people around us. You know, these are often people with mental illness or substance abuse problems. There are folks who are day laborers, like the gentleman I described. You know, just working people trying to make a go of it. And for a decade now, they have not had access to health insurance. If they lived in other states, they would have health insurance, but they don't have it here. And as I think Dr. Lechtenfeld talked about, I talked about, it has had an enormous impact on their lives, their ability to live, to be healthy, even to survive. What this legislation does, we introduced the Medicaid Saves Lives Act. I did it on the House side, and Senator Warnock did on the Senate side. It basically just works around the governor. It doesn't require the state to weigh in. It's a path forward to expand Medicaid without the state's involvement. And that's what is in the Build Back Better Act.
It basically would set up a separate Medicaid setup that people could enroll in, or?
Correct. So there are two paths, one of which would create a federal Medicaid lookalike program. The one that is in Build Back Better is one where low-income people can access health insurance through the health insurance exchange and basically have a zero premium cost to them. So they can just sign up for private health insurance, and that's what this bill is going to do, and it's in place for 3 years.
Congresswoman, about the health care provisions in the Build Better Back, are you confident that those will survive the Senate kind of cutting back on some of the rest of the package?
I am very optimistic, and that's because there are around 40 members in the House who have signed on to my bill, and a number of us, we are weighing in very heavily to make sure that this sticks when it goes over to the Senate.
A follow-up on that is a condition for your support in the final passage, I guess it would have to come back to the House, is keeping this provision in the Senate bill?
We will have to see. I don't want to commit to something like that, but this is very, very important to me and very, very important to Georgia that this be in this bill.
Congresswoman Bourdeaux, a couple things. I know earlier this year with the 1.9 trillion package, a lot of that was directed for access regarding COVID testing, things along those lines. Access seems like it is a recurring issue here. Please reiterate, in the event this passes, how do you think this is going to enhance access to resources and then being able to be that bridge builder that has seemed to be a constant issue in the state?
This bill, this Medicaid expansion provision, will be a game changer in Georgia because this is going to allow low-income people to purchase health insurance on the exchange. So that's private health insurance, which comes with higher reimbursement rates than traditional Medicaid does. So it's going to be very good for expanding access. Doctors want to provide health insurance to people who have private health insurance. And 600,000 people who will now have access to private sector health insurance that they can use for all of their needs. So it's going to have a huge impact. I also want to point out that this is going to have a huge impact on rural Georgia. Some of the provisions in these bills, including Medicaid expansion, rural broadband, they are going to single-handedly make rural Georgia now economically viable. It's going to be great for our community as well here, but it is going to have a huge impact on Georgia as a whole.
Going back to that question about the Senate.
Kurt, you're going to be with me for. I'll cut back to you just one second.
Oh, I just wanted
Sure.
to switch gears before we
Yep.
let you go and talk
Sure.
about the decision by the legislature last week on redistricting.
I will talk to you separately
Okay,
on that.
that's fine.
Yep.
And just lastly on this then, explain why you wanted to cut, I mean, obviously it's been several years the legislature hasn't acted. Why the decision to take that decision out of it?
It just seems like we keep giving the state incentives, one incentive after the next. In the American Rescue Plan, which passed back in March, there was an incentive for the state to expand Medicaid. We made it much cheaper for them to do it. And still, again, they refuse to expand Medicaid. It's just become so politicized. They are not able to do what's right for the people of the state. And so I think a lot of us have just given up. We're just going to have to work around them. It is too important to keep waiting.
As we've seen so many times in the Senate, it's sort of come down to Senator Manchin, and it looks like it'll probably come down on this bill as well. Have you guys been having any conversations with him and his office?
Yes.
To make sure, or is that something that Senator Warnock can
Yes,
lead
we've
on?
had a number of conversations with Senator Manchin, and actually what was in the House bill was part of that negotiation with Senator Manchin, and he signed off on the way that we expanded in the House.
You do expect him to back this bill?
I do expect him to back this. Okay, all right.
Thank you, Congresswoman.
Thanks so much.
Thank you.
Thanks for coming.